Everyone, and welcome to my channel. Hi, I'm happy to see you. I'm your chemist as usual. Today this video we're talking about a nurse. Who is a nurse? A nurse is a person who has completed a basic program in nursing, qualified and certified to administer, to take care of a patient, whether sick, unwell or not. Why do I say so? I say a nurse is qualified, certified to take care of a patient, whether sick, well, or unwell. Why? Because not all patients are sick. For instance, a patient who comes in to the family planning unit to do any of the available family planning method is not sick, but he or she requires the attention of a nurse. A person who comes in to do delivery in a hospital also requires the attention of a nurse, and he or she is not sick, only that the patient wants to give birth good. So there are many things that do take place in the hospital that will require the attention of a nurse. All patients must not be sick before they require the attention of a nurse. Next, we'll be looking at the qualities of a good nurse. Sorry to say this, just as we have good nurses, we also have bad ones. But I believe if you have not stepped up on your attribute of being a good nurse, with today's video, you'll be able to make sure you buckle up and become a good one if you are not a good nurse. Number one, a good nurse must be truthful. A good nurse must be truthful, because if a nurse is truthful, he or she will save the life of, will save a lot of drama. There are some patients who have died in the hospital as a result of what? Having bad nurses around them. If you are a nurse and you are being asked to give a patient a certain medication and you fail to do so, maybe you forget to do so, or I don't know what came over you forgot to do so, or you gave excess instead of the required amount of dosing. Maybe you are asked to give a patient 2 tablets of paracetamol, for instance, and you gave the patient 3 tablets, and you recover. Oh, I mistakenly gave the patient 3 instead of 2. Is your obligation, your right, your duty to quickly report yourself to the matron or to whoever is in charge at that moment that I made a mistake. I gave the patient 3 tablets instead of 2 tablets. Please, what can we do now? Because there is something we give a patient. If you mistakenly give a patient something that is wrong, there is something you give a patient. When you give the patient that medication, it will do what? It will calm down every negativity that had occurred in the person's body. But if you fail to do it at the right time, it might lead to death. So by the time you are truthful enough to report yourself, you report your ignorance to your boss in charge, maybe the metro, whoever is in charge, that this is what I did, I'm so sorry, this is what I did. They can be able to do what? Curtail the situation and make sure everything is calm and the patient will not pass down to the other side of the world untimely. Another qualities of a good nurse is that a good nurse must not reveal a patient's medical history to outsiders, that is those who are not among the medical field. If, for instance, a patient runs a test in a clinic and it is discovered that the patient is HIV positive, a good nurse will not use it to insult the patient. A good nurse, even though he or she is having an argument with the patient, will not use such medical history to insult the patient, embarrass the patient, or make the patient know that he or she is even aware of his medical reports. No, a good nurse conceals it. It's painful though, but sometimes it's painful, but you just have to conceal such patient's medical reports. Another quality of a good nurse is that a good nurse needs to be observant and timekeeping. There are times you are asked to give a patient medication, let me say through IV. Now, as you are infusing the medication, you need to be observant for any reaction. There are some patients that react negatively to some antibiotics. Let's take streptomycin for instance. There are some patients that cannot take streptomycin. If they take streptomycin, they will start having swollen mouths, they will start behaving, they will throw up, they will behave uncomfortable as if they want to pass down to the other side of the world. So if you are a good nurse, you have to be observant. As you are infusing the antibiotics slowly to the patient, you ask questions. For instance, you can ask the patient, how are you feeling? As I'm infusing these antibiotics to you, how are you feeling? Are you feeling like throwing up? How are you feeling? Then the patient will tell you. And another thing is that patients are supposed to eat before being injected. They are supposed to eat, but some patients will just keep quiet and pretend as if they are not they have eaten, whereas they have not eaten. And by the time you start infusing this thing, they will start feeling like infusing the antibiotics into them. They will start feeling like fainting. Why? Because the antibiotics is stronger than the food they ate the day before they took that medication. And since they refuse to eat in the morning. So a quality of a good nurse is supposed to be observant. As you are infusing it, you are observing the physical appearance of the patient. You are also asking the patient to know if he or she is feeling unrest as you are infusing the antibiotics, for instance. As you are infusing the antibiotics to the patient, whatever you are being asked to infuse to the patient to treat the patient well. So you observe, you ask questions. How are you feeling? And so by so doing, you ask questions. When you ask questions, that's when you know if you should continue with such a medication. Because if a patient, if you are infusing, for instance, antibiotic, very strong antibiotic like streptomycin on a patient, we are infusing it and you ask questions, how are you feeling? Are you feeling like throwing up? Are you feeling like throwing up? Are you feeling dizzy? How are you feeling? By the time the patient will say, I'm feeling like throwing up, it means you have to stop. Or the patient will say, I'm feeling like fainting. My eye, some patient will tell you, my eye is turning me, I'm feeling like fainting, I cannot take this again, please stop, please stop. Because you ask them. Why some? If you don't ask them, they'll just keep quiet and pretend as if all is well. But if you are the observant time, by the time you ask them, it creates room for them to open up and tell you how they are feeling. That is one of the qualities of a good nurse. Another quality of a good nurse, a nurse has to be neat. Although I've not seen any. Yes, I think I saw one. There was a day I was going to the market, I saw a nurse. By the time I passed by her, the odor that came out of her was very wonderful. So we advised her. Just took her to a certain corner, spoke with her and advised her on what to do. Good. So that's how to be your brother's keeper anyway. Not that you see them and you see someone, a nurse that is dirty, and you start laughing at the nurse. You just bring them to one corner where people will not laugh at them and tell them, Nurse this, let me say Nurse Tina, the way this your perfume you are using, don't say odor might cause fight. Say, this your perfume you are using, it's somehow, it's not that fine like that though. Why don't you try passion perfume? Why don't you try Tony Matana? Why don't you try 511? I think those ones will look fine on you. This one you are using like this, I don't understand the smell. You can tell them that so do not feel what? Embarrassed. Because a good nurse is supposed to be neat. So you tell them like that, you bring them together, you tell them like that. By so doing, you have also helped another individual to do what? To be a good nurse. Because a good nurse is supposed to be neat. Now, today we have learned who a nurse is. That a nurse is a person who has completed the basic program in nursing, certified and qualified to do what? To treat a patient, whether sick or not. Remember I said not all patients are sick. And all patients require the assistance of a nurse. Like a patient who is about to give birth, is not sick. He just want to do what? The patient is just there for delivery, not that the patient is sick of malaria or typhoid. And the patient who came into the hospital to do family planning is not also sick. The patient just wants to do what? Involve herself in child spacing. So a nurse is a person who is qualified, who has completed the basic program, qualified and certified to take care of a patient, whether sick, well, or not. And we talked about the qualities of a good nurse. We said a nurse must be truthful, a nurse must be able to conceal a patient's medical reports, a nurse must be neat, a nurse must be observant. I know there are many other qualities of a nurse. If you have them, you know I didn't mention them, you can do what? Drop them on the comment section. See, when next we